Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother, baby, postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm perinatal mental health certified and maternal newborn nursing certified. Many women are told to take baby aspirin during their pregnancy, and others are told to avoid it. Today we'll be talking about the use of baby aspirin during pregnancy and whether you should ask your healthcare provider about using it. So click those like and subscribe buttons and stay with us. Why do we use baby aspirin anyway? To be very frank, if we are recommending it for you, it's to save your life. The American College of Obstetrics and Gynecologists, ACOG, recommends the use of baby aspirin for women who are at high risk for preeclampsia. The baby aspirin helps prevent kidney and liver damage, stroke, and even death. This is considered a life-saving medication for these pregnancies. It is recommended that you start between 12 and 28 weeks, but preferably before 16 weeks of pregnancy. You can find on the store shelves baby aspirin, which is 81 milligrams, and regular aspirin, which is 325 milligrams. Regular aspirin is not safe for pregnancy. It's like an NSAID, like ibuprofen or Aleve. NSAIDs are non-steroidal anti-inflammatory drugs. These medications reduce inflammation, they help with pain and fever, but they can also cause some liver issues, and they are linked to miscarriage and early pregnancy. After 20 weeks, they may also cause kidney problems with your baby, leading to low amniotic fluid. So if you are going to use aspirin, or if your healthcare provider has recommended it, they are usually recommending baby aspirin. In order to determine the safety and effectiveness of baby aspirin, we studied it. And the studies studied 81 milligrams of use every day. What was found was that baby aspirin reduces the risk of developing preeclampsia. Preeclampsia is a life-threatening condition for both mom and baby. It also reduced the risk of preterm birth and reduces the risk of SGA babies. That's small for gestational age, and what it means is your baby isn't growing properly in the belly. Finally, it also reduces the risk of fetal and newborn death due to preeclampsia. Please remember to hit the like and subscribe buttons to get our latest content. Are you a candidate for baby aspirin? Well, these are the women that should take baby aspirin. If you have had preeclampsia before, especially if you had preeclampsia with complications, you should be taking baby aspirin. If you already have high blood pressure or diabetes, that's another reason to take it. If you're pregnant with multiples, twins, triplets, etc., or if you have kidney or autoimmune disease, these are all reasons to talk to your healthcare provider about taking baby aspirin. There are many reasons you may either hear about or read about why baby aspirin is used, but these aren't actually true reasons to use it. So when should you not be using baby aspirin? You shouldn't be using baby aspirin if you have a prior history of unexplained stillbirth in the absence of any preeclampsia or risk factors for preeclampsia. Baby aspirin is also not used for the prevention of fetal growth restriction. This is where your baby doesn't grow as well, in the absence of risk factors for preeclampsia. You also shouldn't use baby aspirin for the prevention of spontaneous birth in the absence of risk factors for preeclampsia. And finally, baby aspirin should not be used for the prevention of early pregnancy loss. That being said, if your healthcare provider has recommended that you use baby aspirin and you're not sure why you're using it, you should ask them to go over the risks versus benefits and explain to you why they've recommended it. If you're pregnant and you don't have one of the high risk factors, you may not be recommended to take baby aspirin. However, you should be aware of moderate risk factors. The moderate risk factors include if it's your first pregnancy, if you're overweight or obese, if your mom or sister have had a history of preeclampsia, if you're 35 years old or older, If your pregnancy is an IVF pregnancy, if you have a previous history of a small for gestational age baby, if you had a difficult pregnancy outcome in the past, or if this has been 10 years since your last baby. Also, African American women or women who are of low socioeconomic status, this means you have a low income, you should especially advocate for the use of baby aspirin during your pregnancy. You are considered high risk. And currently, there's a lot of evidence to show that African American women and women of a low socioeconomic status do not receive the same care as other women. This puts you at higher risk for pregnancy challenges and difficulties, and you are at higher risk for preeclampsia. So ask your healthcare provider about taking baby aspirin. For anyone else who fits any of these moderate risk factors, if you have 2 or more of these risk factors, you probably should be taking baby aspirin, so speak to your healthcare provider. I hope this video has helped you learn all about taking baby aspirin during your pregnancy and why your healthcare provider may have recommended it for you. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Remember to share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.